Hello, my name is Bola Alade and I will be presenting my summative presentation. When you look at ethics education, you see that there are multiple phases. Phase 1, Professional Development Plan. Phase 2, the integration of the reflective practice cycle. Phase 3, Professional Socialization. And Phase 4, Leadership Analysis and Professional Practice Development Plan. And when you look at Phase 1, you see that it involves moral character and critical thinking. Healthcare professionals use moral character and critical thinking models in order to provide best ethical decision-making skills and practices. Moral character is the integral factor guiding the framework for ethics education, and it is a reflection of the individual's deep values and virtues, which encourages them to trust in themselves in order to shape consistent, responsible, and experienced actions. When you develop moral character and critical thinking strengths, these are progressive elements to the professional development plan. The incorporation of the two concepts of moral character and critical thinking model provides an elemental structure to address ethical dilemmas, as stated by Peer 2015. And when you look at the professional development, you see critical thinking can be defined as the process of purposeful, self-regulatory judgment, an interactive, reflective reasoning process. And in professional practice, critical thinking involves the critical thinking model and the elements of thought and intellectual standards. There are 8 elements of thought, and these include purpose, question at the issue, information, interpretation and inference, concepts, assumptions, implications, and consequences, as well as a point of view. And when you look at intellectual standards, these include clarity, accuracy, logic, significance, relevance, among many others. There are also common errors to critical thinking. Common errors impact the discernment of the resolution of ethical dilemmas and obscure the critical thinking process. Multiple critical thinking errors can be combined, and they may be primarily rooted in internal and external biases, unwarranted assumptions, overgeneralizations, and unclear statements. When you look at the most common critical thinking errors, you see errors in perspective, procedure, expression, reaction, and a combination of the above. As healthcare providers and professionals, developing moral character, effectively utilizing critical thinking models, and addressing common errors can be a motivating factor to engage in new changes, approaches, and work collaboratively to maintain a climate of mutual respect, share values, and ethical decision-making in the healthcare organization. Phase 2 involves the reflective practice cycle, and in this practice cycle, you see egoism. Egoism is a theory of ethics that sets as its goal the benefit, pleasure, or greatest good of oneself alone. There are 3 forms of ethical egoism, and they can be described as follows. Personal ethical egoism, which is when an individual acts on their own accord and the personal interest and disregards the actions of other individuals taking for their own personal interest. Individual ethical egoism, which is when the individual also acts within their own interest and abides by the approach that other individuals can do the same. And universal ethical egoism, which is the notion that everyone is to act within his or her own interests, which ultimately applies to a self-serving bias. Research demonstrates that healthcare professionals frequently encounter ethical dilemmas and difficulties daily in their clinical settings and practice. However, they infrequently seek ethics consultation. And when you're dealing with ethical conflicts, it's important to seek to reduce conflicts by avoiding self-serving biases, obtaining interprofessional collaboration assistance, and protecting the integrity of the group of people who are participating in the decision-making process, such as healthcare providers, patients, and the patient's family. By being aware of these potentially conflicting goals and implementing reflective practice cycles, healthcare professionals can promote interprofessional collaboration for ethics consultation and resolve ethical difficulties more effectively. And when you look at the reflective cycle, it encompasses a framework of cyclical learning process. It involves the reflection before the action. This can take place before the experience has occurred, the reflection during the action, which typically takes place during the ethical dilemma experience, and the reflection after the action, which involves when action is being taken following the experience and resolutions and/or consequences thereafter. And this is stated by Plaque, Santasier, and in 2014. Healthcare professionals seeking ethical consultation can combat ethical egoism, establish strong interprofessional collaboration, and achieve ethical decision-making in their clinical practice in order to successfully resolve ethical dilemmas. And this is also stated by Hurst et al. When you implement the reflective cycle practice, it demonstrates effective decision-making strategies and which are used to take actions before, during, and after the event of an ethical dilemma or difficulty has occurred. Phase 3, Professional Socialization. Professional socialization is defined as a process of acquiring skills and required knowledge to achieve a professional role with valued and professional norms. This can occur through professional education and experiences in work environments. And this is stated by Jarsenes, Sheriff, Malazem, Kyer, Zaire, and Abadi, 2014. In clinical settings, socialization involves technical skills and knowledge about the diagnosis and treatment and the internalizations of attitudes, values, and perspectives. In addition, it also involves the healthcare providers' feelings about their work, how they manage their emotions, and express their feelings when dealing with ethical conflict. It is important for healthcare professionals to develop personal and professional socialization skills. When I analyze personal and professional socialization skills, I think about the development of 1. Effective communication, for example, providing polite, friendly, and high-quality patient-centered services via in person in a clinical setting or online via telecommunication databases. 2. Establishing a collaborative environment. Research indicates that healthcare professionals have a strong impact on the ethical behavior of their peers, and it's important to note that positive, influential, interprofessional collaboration and communication has on healthcare professionals in their clinical setting. Also, it's important to understand the potential hazards associated with professional socialization. This includes moral distress. And when you look at moral distress, it's very common in clinical settings. It is a cognitive emotional dissonance that can arise when individuals feel compelled to act against their moral requirements. This is stated by Berger, 2014. Some of the most common situations that involve moral distress include aggressive treatment of dying patients, witnessing or the participation of substandard care, and the involvement of withholding information with patients, also stated by Berger. There are certain strategies to mentor others towards ethical practice in the clinical setting, and these include the above-mentioned professional socialization skills, as well as empathy training. When you look at empathy training, you can see research indicates that healthcare professionals who are knowledgeable in empathy training have improved patient satisfaction, greater adherence to treatment plan and therapy, and have better clinical health outcomes. It also lowers malpractice liability, as stated by Bat-Rodden, Chisholm, Antin, and Flickinger, 2013. Engaged healthcare professionals can use the mentoring model to problem solve, develop ethical decision-making approaches, and learn strategies to combat moral distress in order to reinforce their professional moral values and align with organizational values in order to promote professional socialization in their clinical practice. Last but not least is Phase 4, Leadership Analysis and Professional Practice Development Plan. Ethical leadership in healthcare is defined as enabling ordinary people to produce extraordinary things in the face of challenge and change, and to constantly implement superior performance for the long-term benefit of all those concerned. There are many different ethical leadership challenges, and this includes changing practices, policies, and political contexts, as well as government and organizational initiatives, multi-professional teams, and there's also financial stressors. Ethical leadership has different levels. Micro level involves role modeling in their work and in small teams. Meso level involves organizational discussions and policy development. And macro level involves the political involvement at a national or federal level. Lastly, there's different ethical leadership styles, which include transactional, and transactional leadership involves a superior-subordinate relationship. It's not the best type of leadership and is the least desirable. It doesn't provide mutual goals as the leader and the followers pursue their own interests. In transformational leadership, it involves the development of others and is the most desired leadership style. Mentoring is encouraged under this leadership. To develop ethical leadership in healthcare, healthcare professionals can implement a strategy as followed. Using the Professional Practice Development Plan, healthcare professionals can promote authentic transformational leadership. They can also promote self-interest in the community, as well as non-materialistic rewards, and trust in the community as a central component. Conclusion. Ethics education is not about teaching you how to be ethical. It is about learning to make better decisions. Through phases 1 through 4, as well as personal and professional moral value development and consistency, healthcare professionals can be a positive influence to their peers and build experience in ethical decision-making in order to successfully resolve ethical dilemmas and provide the highest quality care to patients and others. Thank you so much for listening to my presentation. My references are provided below.